We're outside Toronto Police Headquarters where the police board was meeting this afternoon, and one of the key items on their agenda is a new strategy for addressing interactions with people with mental health and addictions issues. It has become a top priority for the force. They say it is more pressing than ever before as things like opioid overdose calls are up by 34% this year.
That is a part of, not all of, but it's a part of what we need help with from the Government of Ontario and the Government of Canada, and that consists of things like more mobile crisis intervention teams. We have a very limited number for a very big city now, and that's a team that combines a police officer with somebody who's trained to deal specifically with mental health issues.
The strategy presented to the board today says responding to people who are experiencing mental health and addictions issues is now a fundamental part of a police officer's job. The chief says a significant number of calls, up to 90 a day, involve people whose behavior is affected by these factors. The force says it is committing to gathering more comprehensive data on these interactions in order to safely de-escalate tough situations. Police are often called to intervene and connect people with the services they need, but the chief says that's not a solution.
I know that there's a lot of funding that's going to be put in towards mental health, and if it's done properly, then it will reduce our calls for service and better outcomes will happen, because law enforcement should not be the primary response to people living with mental health. You need those entities that work within the health departments to be the primaries.
It is noted that the strategy is not only focused on the community, but also internally and helping officers who are struggling with mental health issues to get the help that they need.